And good morning. While Paul's getting the slides back up, my name is Dennis Edgerly. I work in Denver, Colorado at a local community college. I'm the director of a paramedic program. And I think it's important just to let everyone know that Paul and I are not representing any organization or entity. So we're not speaking on behalf of the registry or on behalf of COA. It's just Dennis and Paul sharing some stuff. The question and answer box is open. If anybody has some questions they want to type in, I'll try and monitor that. And we'll also try and monitor the chat box down below. If anybody has questions, type them in. And then at the end, we'll have some opportunity to have some discussion about the stuff we're doing. And as Paul said, the testing process is huge within a program. And so we're just going to give some thoughts and some guidelines and look at some practice stuff to kind of help people develop what we got going. All right, Paul, you back?
Okay.
We can see it now.
Am I sharing? Okay. Yeah, I just got the message that my internet was unstable, so seems to be the trend today. But today, here are our objectives. We want to talk about test reliability, test validity, discuss difficulty levels and the point by serial, and just give a few points on how to make high order thinking items that are going to challenge our students to think, higher than just recall and retrieval.
Perfect. When we look at testing, there's two primary areas we do this. It's formative and then summative. And just to kind of clarify some definitions of what we're talking about, formative is the process where we're helping students learn. We want them to make errors so that they can learn from their errors. We want them to grow from their errors. We as instructors and evaluators want to see what they're missing, because in the absence of us knowing what they don't know, then when we go to help them and remediate them, it's just kind of a guess of what they know and what they don't know. So the formative piece is really a workable tool for us. Essentially, I read a book most recently, it's been out for a while, Make It Stick, by Peter Brown. And in the book, he actually talks about the process of testing and about how the more testing we do, the more it makes things stick, actually. And so that's kind of the thought between formative stuff. Summative exams are different, obviously, they have a different name. But summative exams are our opportunity to evaluate where the student is. We typically don't do a lot of review with that. They typically come with some high stakes. In other words, you stay in the program, you don't stay in the program, you pass the class, you don't pass the class, you get the promotion, you don't get the promotion. So the summative piece is a lot of what we're going to be able to apply what we talk to, because the summative piece cuts. And we want to make sure that when it cuts in the right direction. In other words, the people that are going to be good providers, we identify that and we help them move forward to be good providers. And the students that are not ready yet to be good providers, we can actually cut them and help them remediate to become better. So the data and the information that Paul and I are going to be chatting about has a lot of application to the summative piece. The formative. Again, we kind of talked about this, but there's all kinds of formative exams. There's short answers, there's multiple guess, there's quizzes that can happen. And the formative piece, the students have an opportunity to identify what they comprehend and what they don't comprehend. We have the opportunity to see their results. And when we review them and we remediate them, we have the opportunity to get in their heads and think what they're thinking. So I watch some of the faculty here, and when they review tests with students, they'll sit down and they'll review the tests and they'll look at the questions, and the student will have something wrong, and the instructor will say, see, we told you in class that was wrong, that's why, now let's go to the next question. But we can use formative tests so much more deeply. So they have the opportunity to look at a test and see the test question that the student answered and ask them, why did you answer that way? What were you thinking? This is the correct answer. Why is this a better answer as opposed to this? And help them move through this process is huge. It's huge in their cognitive development and the ability to put things together. And a lot of the research continues to point towards continual testing, repetitive testing, and even going back, we tend to test like big concepts in chunks, but they even go back and grab some previous content and bring it and intertwine it, and then bring it and then intertwine it again is huge. And again, these are low stakes. They're designed to be teaching tools, so these shouldn't be cut and go kind of stuff. Paul?
Yeah, I like to add that, not only is this formative assessment of our students, but it's also a formative assessment of us. So if our students aren't getting a concept, we can look back and see, is that them or is that us, or is it both of us? And so, for instance, we had a quiz once where we were testing the pediatric resuscitation triangle, and we were asking the students to enter this item. And what we found is that everybody missed the item. We're like, wow, how did that happen? Because normally this item performs really well. And so we went to the instructor that actually taught that course, and he actually mistaught the content. And so it showed up on our quiz where all our students actually missed the correct answer. And so we had to go back in and reteach the concept because we had previously taught it incorrectly. And so again, it was very formative for us as a program to make sure that our teaching was correct.
Absolutely, yeah, good point. And as medicine moves forward, as AHA and other groups come out with new data and new information and new guidelines, we need to make sure that we are testing students appropriately in the process of us adjusting our curriculum, which is what we teach, how we teach it, when we teach it, who teaches it. This gives us an insight to what that looks like and takes place. Awesome. The summative exams are kind of that. They're summative exams. These tend to be high stake exams. These are the exams where we've offered the students a bunch of content. We've helped them through the curriculum we've developed by either labs, scenarios, clinicals, lectures, reading assignments, written assignments, whatever it is. We've used the formative testing tools to test and evaluate and tweak and test and evaluate and tweak and modify. And now it's time to kind of do a collective all together. Let's sum it up and let's see what we know. These are kind of go, no-go tests. We need to spend a fair amount of time on these exams to make sure that our questions are good and appropriate. And I think, especially when you first start writing questions, no question first pass is ever great. Test writing at the registry, if anyone's ever had an opportunity to do that, the saying when you walked into the room with the group was leave your ego at the door, because no test question is ever going to go through unaltered to some degree. And the test question we think we have great in our head, once you actually start looking at data and statistics and outcomes, and then you compare that to final outcomes, everything else, we have to be willing to go back and alter these and tweak these. And these things take years to develop. These are the summative exams that we also kind of on the side need to keep pretty secure. If anyone is a paramedic program director and has ever been through a COA site visit, one of the questions I'll ask is test security. Who has your test? Who has access to your tests? How do you regulate your tests? And these summative exams need to be kept really secure, because they take tons, hours of work and multiple repetitions of students going over them again and again and again, and you tweak them a little bit and tweak them a little bit and you tweak them a little bit. And by the time you have this tool that works for you, if those are ever compromised, the thought of starting over to create another summative exam is just daunting. And so a lot of what we're going to talk about today, and Paul's going to talk about some statistics, are really focused on these exams.
So to transition a little bit here, so we mentioned that formative examinations are to form. They're to give feedback to the students as well as the program. The summative exams are really that, as Dennis just said, go, no go. Are they competent or are they not competent? Those kind of things. But how we get there, the mechanics behind these examinations is we want to make sure that our examinations are reliable and valid. And so here, to give you an example, reliability has everything to do with consistency. And so the examples on the screen here is if I go to my scale because I'm trying to lose weight, and I get on the scale on Monday and it says I weigh 200 pounds, and then Tuesday I get on and it says I'm 202, And then Wednesday it says I'm 201, and then Thursday it says 200, and Friday it says 201. I have some reliability there in that scale. It's consistently weighing me accurately from day to day. But if I went to the circus and I walked around the circus and there were 5 different weight guessers there, and one told me I weighed 185, and one said 200, and another one said 210, and another one said 215, and another one said 160. The reliability there would be very poor. And so what we want our examinations to do is to measure our candidates or our classes consistently from one candidate, from one group to the next. And so when we have that occurring, we then would say that we have reliability. And so some things that we know that typically don't have high reliability is when we assess skills examinations. And so there's a lot of artificiality in those, but there's also a lot of differences between the person who's assessing one candidate to the next. And so perhaps I'm an easy assessor, and Dennis may be that person that's really tough. And so again, it's best that we can wait those things out together, but sometimes we can't do that, especially when we have one person doing a skills examination of a candidate doing intubation or whatever that particular skill is. And of course, another inconsistency with poor reliability are essay type questions. And so again, I don't think EMS uses essay questions a lot, but they certainly do exist. One way to look at the reliability of our examination is looking at the KR20 score. And really what this does is it takes a dichotomous item, meaning it's right or wrong. And what happens is the computer goes in and looks at, for instance, all the even numbers and all the odd numbers and compares the two against each other. And when we have internal consistency on the examination, it will give us a score somewhere between 0.6, 0.7, maybe even 0.8 if we're really good at this. But it's just looking at the internal reliability of the entire examination. So if you have 60 items, it's comparing 30 items against another 30 items. And so again, it's just giving you a score of the reliability of the examination as a whole, as opposed to item by item, which is what we're going to shift into here in just a second.
And Paul, your picture with your little shot thing, I think it's important. I know you're going to talk about it, but the reliability does not mean that it's valid. So if you evaluate your test and it seems to be going really good and you do your printout and at the top it says, KR 20.8, and you're like, yes, I got it. That's great, but that's going to be different than reliable. So just because it's everything's performing kind of consistently doesn't mean it's performing good. And I know you're going to talk about it next.
The target's a great example here. So of course we're aiming for the bullseye here. We are not hitting it. So we don't have a valid attempt at the target, but we do have reliability, because if you look at the shots here, they all tend to be at, what is that, about the 7 o'clock position. So consistently, we're hitting the 7 o'clock position, which is showing that we have some reliability, but the problem is we don't have validity because we're not hitting the target. Whereas with this slide here, we are reliable and we are valid. We're reliable because all those shots are in the target zone, and they are valid because we are hitting the target. And so this is what we want our exams to be. We want them to be reliable, so there's consistency between the examinations, and we want them to be valid, meaning that they're measuring the concepts that we really want them to measure. And so when we hit the bullseye here with our tests, then they are reliable and valid. And so validity is really just the measurement of whatever it is we intended to measure. So for instance, if we're having a medical examination, we want to make sure that we're actually measuring medical content and not trauma content. And so that has a lot to do with how we construct the exam based on the objectives of the course. But that is super important to get the validity that we're seeking here. And so when we have a valid exam, the scores correlate with the student's knowledge, meaning that our high performers should actually be doing a really good job on the examination and getting the higher grades. And the candidates who are not the high performers should not be getting those type of scores. And so again, we're going to look at some metrics here in just a minute and explain that further. But if we have validity, the test is doing what we intended to do. It's measuring the concepts we want, and it's doing it with consistency. So different types of validity. The first one here is this concept of face validity. This would be Dennis and I just eyeballing or spitballing a test and saying, yep, that test does measure medical emergencies, because we just kind of run through the 60 items and say, yep, those all are medical emergency type items. And so again, it's not very scientific. It's just a lot of common sense. It's the very lowest level of validity. But if we want to go further, then we do things like blueprinting our examinations. And we make sure when we blueprint the examination, it measures all the concepts related to medical emergencies. So we want test items on there that are asking things for anatomy, physiology, pathophysiology, assessment, management, anything to do with that particular type of medical emergency. We want it to reflect the depth and the breadth of that particular content. And also we want our tests to have some objectives or some items that are kind of lower level. We also want some mid-level and high-level items. And so we don't want all our items to be too simple, because then we really don't get a measurement of the student's knowledge. And so I guess you use the Bloom's taxonomy here. The example is we really don't want items that measure just simple knowledge. So we could ask, what's the normal blood pressure? And I would dare say that 99, maybe 100% of our students could say that the normal blood pressure is 120/80. And so again, that really doesn't, to me, it reflect competency. Okay, they know a concept, but is that competency? Can they use that concept? Can they apply that to the work environment that they're getting ready to go to? Comprehension also is a very low level. So they comprehend a concept, but again, they can't apply it. And so when we write our examinations, we want them in this application, in this analysis area. So we want them to be able to use that knowledge when they leave our classroom and actually go to an ambulance or emergency room or wherever they're going to work at. And of course, we also want our examinations to have some medical accuracy. And so we want our medical directors to get involved to make sure that we're asking legitimate clinical concepts and we don't have a misconcept of ourselves. And so again, medical accuracy is certainly important in this as well. And then lastly, this criterion validity is really, think of it as predictive validity. So what that means is that we want to know that our students are performing really well on our examinations, can actually go out and perform the job in the clinical site or the field internship. And if they're getting A's on our examinations and then they go out and write with the preceptor and the preceptor says this person has absolutely no clue at all, we do not have very good predictive validity. And so again, we want those tests to reflect what they're actually going to do. And so if you're getting those comments from your preceptors that this person has no clue, yet they're getting an A in your class, you probably need to go back and look at the validity of your examination.
And a couple of good points Paul made, just to kind of reinforce. Paul suggested that the medical director gets involved. At the paramedic level, the medical director has to be involved. At some point in time, your medical director needs to review your test items, not necessarily on your quizzes and your day-to-day stuff, but your big summative exams, you need to make sure that you consult. Typically 2 to 3 of your expert faculty, and then your medical director needs to sign off and say, yes, these are medically correct and medically accurate. And then kind of a corollary to what Paul was saying about predictive value of street. For years and years and years, I think EMS instructors have heard there's the classroom way and then there's the street way. And evaluators say, yeah, that's what you learn in the classroom, but here's how we really do it on the streets. And it really shouldn't be that way. The classroom should truly reflect what the heck the job is. And so we as educators need to make sure that our labs, our skills, and everything else, but our written exams are actually evaluating what students really need to know before they hit the field. And Paul's example of, yeah, you got the straight A student, but they can't run a call when they get to the streets. We have a problem there. Now, post-review. Post-review is when we need to take a look at these tests. And so we spend all this time, we get our group of experts, we talk to our medical director, we use reference materials, we make sure that the questions are valid and everything is good, and we write the test. We write the questions, we all like it, we feel good about it, and then we deliver the test. The students who take the test kind of become our testing subjects, if you will. And what we do is after the test is done, we have to go back and review the exam. And this is a have to. You got to go back and review to see how the students performed. The test reform, you're going to look at the overall test. You're going to look at some numbers up top to kind of say, you can look at the KR20 score and say, yep, for this test, this is, a very reliable test, or it's not a reliable test. But then the test demands that we go through and discuss every single item, which can be very, very laborious and tedious, but it's a must. It's a must if our test questions are going to be valid. So we look at the test questions and we identify what percentage of our class got the test question correct. We'd like the majority of them to get it correct, but we don't want all of them to get it correct. And I know that sounds horrible as an educator, but if you have a test question and 100% of your students are answering that test question correct, the test question is not discriminating. So that, in other words, it's not telling us who knows the content and who doesn't know the content. So if we're doing formative exams, that might be great. I might be very happy that a bunch of students are getting test questions correct. But if I give a test and 100% of the students get 100% on the test really hasn't shown me anything. So we want it to be less than 100. If you have less than 40, 50, 60%, be careful what you do with the test question. I've talked to a lot of educators and worked with a bunch of educators. If the majority of, define majority however you wish, of their class gets the test question incorrect, the educator automatically throws the test question out. And I strongly suggest against that for a variety of reasons. One, we as educators have worked really, really hard to make sure this is a good tool, that it's a good tool and it works and it's valid. And so we like it. Secondly, once we take a look at this test question, if only 30% of our class actually got this test question correct, it does not mean that it's a bad test question. It may mean that it's a difficult concept, but we need to make sure that it's discriminating appropriately. It's kind of like an alarm on a mechanical medical device. If we're running a vent or something and the alarm goes off, the alarm is going off for a reason. We shouldn't just shut it off and ignore it. So if you have a low value on your test score, please don't throw it out. The other thing that it does, the other big impact it has by throwing the test question out, is when cut scores are determined and you establish a cut score for your test. Let's say your cut score is 70, 75, 80. That number is kind of arbitrary based on the difficulty of your test. But if you establish your cut score and you have 50 questions on your test, which is kind of low, but if you have 50 questions on your test, each test question is worth 2 points. If you throw 3 or 4 of those test questions out, now each test question is worth more points, which means a student who may have not passed will pass, and vice versa. So throwing out a test question can actually, it will alter your net score towards the end. So don't just look at the number and kind of go, oh my gosh. So if a whole bunch of your students miss it, we should probably take a look. If all your students get it correct, we should probably take a look. But I strongly suggest you don't throw it out.
So, hey, Dennis, I'm going to add that, just reinforce here that if we had an item and only 30% of our class got this correct and the other 70% missed it, there's a chance that we would keep this item. There's a few more metrics we want to look at, but we perhaps may want to keep that item, and if we are getting items that are 90% and 100% correct all the time, I don't even think that test item belongs on the test because it's just not doing anything for us. And we'll go to the next step here, and we'll talk about how do we know, should we keep that item that has 30% of our students answering it correctly?
Absolutely. So we identify these questions, and so we identify the questions where the class had a problem. But then we look for a point by serial value. And a point by serial value, basically what it does, and you can find these. So whether you have you're using Blackboard, D2L, Moodle, you're using a Scantron form, you can identify these values. They print them out on your test analysis. But on our post-test review, you look for the point by serial number. What a point by serial does is it looks at the test question and identifies who got the test question correct and who got the test question incorrect. And this is, I know it sounds kind of horrible when I say it, but what we want is we want the students who are our high performers. And the test knows who our high performers are because those are the students that got the high scores on the test. So it's not the high performers in your class per se, it's the students that got the high score on this test. So the test looks at the students who got the high score on the test, and it looks at the people who got the low score on the test. And then it looks at this test question and identifies who got it right and who got it wrong. And if the test question is performing appropriately, the students who got the test question correct should be in your high performing category. And the students who got the test question incorrect should be in your low performing category. That means the test question is discriminating appropriately. Where we get into trouble is if we look at the test question and we find that the high performers are getting this test question wrong, but the low performers are getting this test question correct. So if we look at test scores and Bob got a 90% on the test and Bob missed this test question, but Joey got a 30% on the test and he got that test question correct, we probably have a problem with that question. Point by serial is based on a scale of +1 to -1. Usually what you want is like a 0.4 or higher would be really, really great. Zero scores, they're not discriminating. That means that 100% of your class got the test question correct. It's probably a simple item. And sometimes we have to ask simple questions, but I would almost suggest that those are done on the formative exams. We ask the simple questions like, patient doesn't have a pulse, what do you do? Start CPR. That should be on a formative exam, not on a summative exam. We should have already determined that they know that as we move into the summative piece. So zero discriminations, they don't help. They don't help you discriminate your high performers and your low performers. So we want a number that's like 0.4, 0.5, 0.6. So to Paul's point, if we identify a test question and only 30% of the class got that test question correct, so 70% of our class missed that test question, but the test question actually had a point by serial of 0.8, that's probably a really, really good test question, which means that only 30% of your class got that test question correct, but it's the 30% that are the top performing students in your class. Whenever you see a negative point by serial, it tells you that your test question is discriminating in the wrong direction, which means the students who have scored low on this exam are getting that test question correct, and the students who scored highest are getting that test question incorrect. Now what we got to do is we got to go back and figure out why that actually took place. Why did that happen? Commonly, when you look at negative point by serials, it was miskeyed. It was miskeyed. So if you have only 30% of the students that got this test question correct, and the 30% of the students that got the test question correct, they were all the lowest, they failed the exam, but they got this test question correct. You're gonna have a negative point by serial. Your point by serial is gonna be like -0.4 or something like that, which is horrible, by the way, really, really bad. Commonly what happens is you go back and you relook at that number and you're like, oh, the answer should have been C than D. The computer had it miskeyed. And so when you fix it, you fix the question, then it changes the point by serial. So go back and figure out why it is what it is. And this test evaluation process is a step by step stuff. So you can't, we start by looking at who got the test question right, who got it wrong. Great. Now we go through and we identify the point by serials. The point by serials that are 0.8, 0.9, 0.4, 0.6, leave those alone. Leave those alone. 0.4 less negatives have to be addressed. So we'll go back and we look at those. The other those are that the test question was just not built right. The distractors were misleading. It was one of those not double backwards, not except then questions. And your high performing students will tend to get those wrong. So we need to avoid the especially the double negative backwards not questions, because yeah, we need to rewrite those into this is, this will, this I expect, something like that. And then the other components, we go back and look at our curriculum, and maybe the content was not addressed. Maybe we didn't teach it as thoroughly, we didn't teach it as in depth as we could have. Maybe it was mistaught somewhere. And it's crazy what students will pick up on from different instructors, but what they think is a priority and what's not a priority. So as leaders in the class, yeah, we go back and see what the heck actually was taught. Did we actually do it? Did we not do it? So Paul, you got some items for us to look at?
Yeah.
Oh, nice. Yeah, sorry.
Yeah. Before we transition to that, I want to talk about this here. You know, when you look at items that are 90% of the class is getting it correct, or it's not discriminating like we want, we can go and look at two areas of the item. You know, we can look at STEM. And so these are just some tips that I've seen. You know, Dennis, you and I taught the NAEMSE Evaluating Student Competency Workshop course for like 5 or 6 years. And in that workshop, we asked the students to write items and submit them before they came to class. And you and I looked at those and gave them feedback. And, you know, I reflect back on what I learned as we looked at those items over those years that we did this. But usually there was a problem with one or two places. It was the STEM or the options. And so in the STEM, what I think I saw most often was the information was presented so textbook. You know, a patient with a heart attack presented with shortness of breath, substernal chest pain radiating to the jaw with diaphoresis. And I mean, it was just this perfect textbook example. And everybody knew what was going on with this person here. And so, you know, the truth of it is that our patients don't read the textbooks. And the truth of it is they don't actually present like the textbook says they should. You know, think about those atypical MI patients, you know, your elderly patients, your diabetics, and women. And so, you know, when you muddy the water a little bit in the STEM, that tends to make that item a little bit more challenging for them. And I would even argue that the fidelity is higher because it's more realistic as to what they will see when they enter the field. So again, if you're writing items, STEMs that are perfectly textbook, I would ask you not to do that because I don't think you're preparing your students for what they're going to see in reality here. And then on the STEM side, you know, the distractors, a lot of cases are just really too easy. So we asked a question about pericardial tamponade, and the 4 options below, only one of them has anything to do with the heart, and the other 3 have nothing to do with the heart. Those students who are the high achievers can really tune those out really quickly, and so can the ones that are not the high achievers. And so again, you have to look at those distractors and make sure that they're you know, Dave Page would say tasty, attractive, those kind of things. And so if they're not very attractive and nobody's hitting on those items, and that's another thing you can see in the printout, is option D being selected by the candidates? If nobody in the class selected option D, perhaps that's something you need to change and make it a little bit more attractive. Other things to test are, you know, common misconceptions. I think one of the things I see in Dallas, Texas a lot in the field. So here I'm going to throw out a hand grenade at the operators is that if a patient has they always throw it at us, Dennis, educators, you know, so it's just coming back to them. But, you know, if you have a patient who has shortness of breath in the field, in the back of the ambulance, what I've seen is everybody gets albuterol and Atrovent. Doesn't matter that they're actually having CHF or some other type of cause of respiratory distress. They're going to get albuterol and Atrovent over and over and over in the field. And so again, that's an example of a misconception that's currently out there. So if I had a respiratory distress question, I might put in there as an option, even if it's incorrect, is the use of albuterol and Atrovent, because somebody might select that. So again, when you have these items that are performing, they're too easy. You know, look at the STEM and make sure it's doing what you want, and make sure those distractors are attractive enough to draw somebody to it, you know, especially those candidates who don't have a good understanding of the medicine here. So yeah, let's go look at some items here. So these are examples of poor items, and we'll just kind of work our way through and talk about why they're not performing. So this question is asking, when conducting an annual employee review for a paramedic that does not routinely meet quality management measures, you should. Here, we've got 84% of the class answering the item correctly. The green is telling you it's correct. But the discrimination index is 0.02. And Dennis, you said that we'd want that to be around 0.4 or higher. And so I guess, what are your thoughts of this item, Dennis?
Yeah, so when I look at it, I kind of like the 84%. That's good that we got it correct. But the value, the 0.02 is kind of concerning. So we have 5 people that answered it incorrectly. And so what the point by serial would suggest is that these 5 people that answered that question correctly actually are the high performers in the class, which means some of our low performers are actually getting this test question correct, which means that it's not doing what we want it to, not doing what we want it to do. So we need to go back and kind of look at these distractors and make the determination of, is there one better? Is this actually a correct test question? How was the information put together?
Yeah, and I would add option D, nobody bid on it. And
Yeah.
so perhaps you want to change that out and make it something a little bit more attractive. So this one here, I'm not going to read the question here, but 74% of the class got this correct. Every single one of the answers were actually selected. That's a good thing.
That is good.
But the discrimination index is a negative 0.12.
Yeah, this one is hurting us. This is hurting your students. If this was a final summative exam and this test question was making the determination of who passes the class and who doesn't pass the class, the discrimination index of negative 0.12 suggests that this question is going to make your high performers fail the test and it's going to make your low performers pass the test. Obviously, there's more test questions involved, but this test question is reverse discriminating.
Yeah, so this is our high test takers are not answering this test item correctly. Here's an example of an item that's entirely too easy. Options A, B, and C did not play at all. Everybody took D. And so because everybody got this correct, the discrimination index is 0, meaning it did not discriminate. And the reason why it didn't discriminate is because nobody missed it.
Right. So great on a formative exam, but on a summative exam, it's not really telling us. Not really telling us that much.
The next one here, we've got, this is almost the same example of the previous, not the very first one or the next one, but here we've got 77% of our people answering it correctly. Option A needs to be revised because nobody selected it. But again, we've got this negative discrimination index, meaning that some of our better test takers answered this item incorrectly.
Yeah, but so we need to go through and yeah, evaluate the answers, evaluate who answered them, make sure our test questions are correct, look at content, because this test question isn't doing what we want it to do.
This one here, and this one kind of speaks for itself. The options are C and D are picked. It actually, if that one respondent would have picked D, we'd have had 100% correct. And the discriminant index would have been a 0, but because somebody picked letter C, now obviously that was one of our smart candidates, believe it or not.
Right. That the one person was probably the high performer.
And that's why we got this negative discrimination. So again, these items are examples of bad items, and these are not numbers that we want to see when we go through the examination, post-examination, make sure they're performing the way we want them to.
And when you review these, it's easy to run a report and look at them and kind of go, okay, these are good, these are bad, and then we put it on a table and say, we'll fix these before we run the test again. I would suggest you fix them right now. As soon as you run them, as soon as you get that data, sit down with you, your faculty, your medical director, and look at those items and make slight modifications to those items. And if the item is consistently performing poorly, maybe the item goes away. Just take it off the exam and don't subject other students to that item. If you're continually getting zeros and negative point by serials, just make it go away.
All right, we're going to shift to the positives here. So this is one of those items we just talked about. So 34% of our class got this item correct, and we'd be going, oh no, this is horrible. But when you go look at that discrimination index, it's a pretty nice little number there at 0.32. And so the only thing I would say in this one here is that nobody selected option D. So you might want to do something to make that a little bit more attractive. But this is an item that I would keep. I would not throw out. I would be very satisfied knowing that the people who did really well on this test actually got this right. And those 17 responders who took the decoding barrier clearly didn't have a clue. And so these are the people that didn't do so well on the examination. So I think this is a great item. I would not throw this away.
I agree. And if we look at test questions, we'd go through first we probably pick up on the 34% and kind of go, oh my gosh, let's look at the test question. But then I look up and see the discrimination index of 0.32. Let's let this one sit. I bet we have bigger fish to fry.
Here's one where we've got 80% or 79% of our class answering correctly. The discrimination index, man, that's beautiful. A 0.51. So we really like this item. The problem is that letter B is really not playing very well. And so we might go in and revise that somewhat and make it a little bit more attractive. But again, 80% of the class got this right, and the discrimination index of 0.51 makes me really happy as the teacher.
Absolutely. Hey, and Roger put a quick question in the post, and others can answer. Any computer-based software that your college runs, if you're running through a college, will track this information for you. And I believe Moodle is still out there, and Moodle is a free use, open source program. And I believe Moodle can extract this data for you as well. Someone can chime in if that's not correct.
We use Scantron, so I know Scantron will do it.
Yeah, so the mechanical Scantron machine, you can plug it into your computer and extract the data as well.
The next one here, in the interest of time here, is 88% of our class got this item correct. The discrimination index is 0.43. Like both of those numbers. I also like that all 4 options played.
Mm-hmm.
It was attractive enough for somebody to take the American College of Emergency Physicians and the National Association of EMS Physicians. So pretty nice little item there. You know, I mean, it's getting up there close to that 90%. I may want to change out one of the other options to make it a little bit more attractive. But overall, the discrimination index is solid as a rock, and I like that.
And I would agree. And going through, you know, questions that are tests that are 80, 90, 100 questions, when you see a good question like this, just let it go and find one that's discriminating not well, like we previously looked at.
Here, another one. Again, I look at all the options are playing. They all got selected. 85% of our class got this correct. And the discrimination index is 0.48. So the smart people got this item. The people who weren't so smart did not, which is exactly what we want our test items to do. Ooh, this is crazy. This is a true false. I think really the metrics here is that we only had 6 respondents, but we might see something different if we had 30 students. But in this case here, 33%, 2 people actually selected the right answer, but the discrimination index is 0.9. I don't think you see a discrimination index of 0.9 too often. No. So clearly the smart people knew the answer to this one. The other 4 obviously didn't do so well in the examination, and they picked the wrong answer. Again,
yeah, I agree. And generically though, and the point by the discrimination index is good. But overall, true false questions, if you can avoid them, they tend not to be the best determination, because it's a 50-50. Someone can sure guess right and skew your numbers one way or another. So yeah, great point by Cyril. But
if this was a multiple choice item, and you had 4 options and you had about 30 students and you saw these numbers of 33% picking the right answer and discrimination index of 0.9, don't throw that item out. It's perfect.
Yep.
Great item. Here is, we could do a whole discussion on 3 answer options, which are really good, but that's not today's lecture. But this one here is 67% of the class got this correct. And again, the numbers are small, but the discrimination index is being 0.55. And so really what we're trying to do is illustrate the numbers, 67% and 0.55. This is a great item. Keep it.
Absolutely. And when you have classes of like cohorts of like 6, 7, 8, 9, 10, a cohort of 30 would be awesome, or more. But when you have small classes, you can also go back and I do it with our paramedic classes. And our paramedic classes run 20, 25 students, and I run 2 of them a year, which I know other programs do a lot more. But I will save some of the summative exams. And if I don't end up modifying a question, I'll take like 3 classes and put them together, and then I'll run the data again to see over the course of 3 programs and just collect data in more of a cumulative way to check the reliability of the exam over 3 cohorts. So you can save some of your data and play it again. It's hard to do that with online stuff, but it works well with Scanner.
And then last, we wanted to touch on post-test actions. And so this is an example of what we did in Dallas, Texas. And so what you see here is our notes that we kept on a particular examination. My guess is that this exam had about 60 items. I don't remember for sure, but you can see that we're indicating the item number, and then we're writing down the difficulty level, the discrimination index, and we're also notating what we did with the item. And so this is not my handwriting, so some of it I can't read. But look at option number 2. It says that 71% of the class got it correct. The discrimination index is 0.12, which is not super strong. So we gave it a little bit of love, and we reached out to the medical director, had a discussion with our medical director, and we all felt like we should keep the item. So that's the note that you see there. In item number 19, you see, look at that, it's 68%. It's a negative 0.33. So some of our smart people did not get this item right. And so our notation says we took letters C and D, and we're going to change that for the next exam. And you can kind of just see our notes all the way down. And this is a COA requirement for paramedic programs, is that you scrutinize your examinations and make adjustments, to future examinations. So this is us taking notes at UT Southwestern, and then making the adjustments to the examination for the next group that would have seen this examination. So this would have been a summative examination because we didn't do the scrutiny to this detail on our formative exam. Not saying we didn't, but not to this detail. So this is just one example of what we did in Dallas, Texas.
And Paul mentioned that it's a COA requirement, and this is actually the COA form. So if you go to the Committee of Accreditation of Allied Health Programs, you can actually download this form. And this is a requirement that paramedic programs take their major high stakes. So not their formative stuff. You can do whatever you want with the formative exam. Play with them, tweak them, adjust them, throw them out, keep them, apply the grades, whatever. These are the major high stakes. Gonna pass, not gonna pass. Cut, not cut. It is a requirement that you go through and you do these evaluations on your high-performing exams. And you see at the bottom, the program director is required to sign. And there's a little, did you review this with faculty, and did you review it with the medical director? And then kind of a summary of the document Paul showed. What did we change? What did we alter? What did we keep? How do we do this? And accreditation, when you have your site reviews, the site reviewers will sit down with you and say, how do you do this? How do you evaluate? Show us what you do. And they're going to ask to see what you did and why you kept a question, why you didn't keep a question, how you evaluated a question. And EMT, AEMT programs, EMR programs are not currently being scrutinized by COA, but I think, Dennis's 2 cents here, I think it's good practice. And so there's no reason that at any level of EMS education, we can't incorporate these same exact concepts to help people move forward.
The thing I want to add here is that I don't know how many items this is probably about 8 or 10 items that we gave some attention to on this particular examination. But what it does is it improves our examination because we go back and look at these items and make them better. But also it calibrates the faculty group. So if Dennis and I are looking at this examination together and we see these kind of numbers, we can talk about, in this case here, injury prevention or something to do with legal or whatever that concept was. I think the second to bottom last is GCS, and then the last one is legal. But we can actually talk amongst ourselves to make sure that we're teaching this and measuring this the way we want to, so that we improve our instruction and make sure that we're consistent between instructor groups for an item. So this is really helpful, not only for improving your test, but also calibrating your instruction and making it better.
And the final kind of piece for instructors to consider is, after we do all this great work, we've got these great exams, we've evaluated our questions, everything great, we need to evaluate post-evaluation of evaluation. So most of our students are going to go and take a national registry assessment. If we have these great exams that we really, really love and the values are great, but all of our students are failing registry, we have another problem somewhere, which is a different webinar that we can talk about. But look at your question, look at your stuff. But then look at it at someone else's evaluation. And when you look at test question data, oh my gosh, like registry or don't like registry, they do more matrix and test metrics with test writing and stuff like that than probably anybody has the opportunity to do. So we need to put some credence in the exams that they offer. And if everyone's passing our exams and our test numbers are great, but they're all going to fail registry, we got a gap. We got to go back and look at that, what's going on. Awesome.
I think the really important slide there that we showed today was the one where you need to go back and look at your stems and decide, is your stems and your patient presentations entirely too simple, or your distractors attractive enough? And so when you can get your stem right and your correct option and your distractors right, you probably have a really solid item. And so that's really the magic to this, to creating really good test items. And of course, it comes about because we're using metrics to make the items better.
And just kind of as Paul mentioned the evaluating student competency workshop that we did for a bunch of years. One of the participants asked us once, we were talking about this in class, and they said, when are you done? When does this end? And the answer is never. Never. Test evaluation is done every single time you give a test, and it's just this continual pruning and picking weeds and fixing and altering and adding and modifying. It never stops. So embrace it as an education lifelong journey.
Yeah, I mean, to me, this is just as important as putting together objectives and a lesson plan. This is just another step in the education process. And so fortunately for me, I always enjoyed this part. I would rather spend time building an examination and scrutinizing it than I would a lecture, but that's just me.
Rio posted a thing about registration for the NAEMSE CE piece. Are there any questions? I don't see anything in the chat. Thank you, Scott. And as always, Paul and I are happy to respond to emails if anybody has questions or comments or anything else. Awesome. All right. Thank you, Paul. Thank you, Rio.
Of course. Thank you both so much. I will make sure that I put your contact information in the Zoom email that goes out tomorrow, so that way anybody can reach out.
Julio?
I'm sorry?
I said cool.
Oh, okay. Sorry, it froze over here. So yeah, the link's in there. If you guys missed that link, then it will be in the Zoom follow-up email as well tomorrow. So thank you both so much.
Thank you. Take care.
Have a great day. Stay warm.
All right.